Dr. Aishwarya, can you just share with us about your success story? How did you start it, and like the ins and outs and everything? And first of all, congratulations for passing this exam. Okay, I'm so
Thank you
happy
so
for
much, sir.
you. Okay, so just as a brief, can you just discuss about those things to all of the candidates so that they can have some ideas about their exam, how to prepare, and what they should do and what they should not do, and how to prepare well and all that stuff?
Sure, sir. So one thing about me is that I am a post MBBS student and I haven't started my surgical training. So that is one reason I was very underconfident, and that's the most important thing I feel, that during the exam we have to be very confident. So since it's a relay of many stations, I made sure that I smile before that 1 minute I read the question. I was smiling, I took a few deep breaths, and I made sure I was very confident when I entered. So as soon as the bell rang, I used to enter confidently, even though I don't know what I'm doing. I wanted to be confident, and I think that helps. So that's one thing I want to add. And I think all the other doctors mentioned a lot of the same things. And on the day of the exam, of course, as everybody has said, and I've heard this so many times because I have attended so many of sir's success stories, that we have to make sure that we leave one station, whatever happened, even if it goes bad, leave it. When you're coming outside, leave everything in that station itself. So when you're coming outside, again, you're a fresh candidate, right? So make sure you don't take it forward, because in my station there were lots of stations, like skill stations, that weren't up to mark and I wasn't satisfied. For example, we had a male catheterization station, and the examiner um, did not tell me that consider it done. So when I put my the insta gel, and he said, he didn't say anything. So I said, I'll wait for 5 minutes, and he didn't say anything. So I was just waiting for a while, and then I said, okay, I'll consider it done. He was just walking around. So again, that my confidence was down. And when I came outside from the station, I made sure I forgot that part, and then the next station you go fresh again. So I think that's something that's the trick. That's the only trick. And coming to preparation, so I because of some financial reasons I couldn't buy the complete course, and but I was attending the free mocks, and I in the beginning, sir, I was attending every free mock of yours. I made sure I was free, but then again sometimes I couldn't attend, and then I realized that the mocks are very, very important for me, because there are so many new things you learn in the mock. Because like uh, part A is just theory, but part B is practical. It's so you need the practice. So I used to attend his free mocks. Then I also bought the subscription for the free for the mocks. I used to go through all of sir's mocks and make notes so that I revise from the mocks, because they are all the new questions or the new topics that have just been asked. So I think, so that was very important, and that is the reason for my success. So success story is basically you.
Thank you so much for that. But your hard work, it is your hard work, okay? That's why you passed your exam. And I was amazed, like when you said, okay, you just pass in after your MBBS, you
Last
pass in
year.
January, yeah, and
Yeah.
then just you pass the like part B. It's very nice, superb,
Thank you, sir.
very nice.
So
Yeah.
that's all I would like to say. So if anybody needs any help, they can let me know. I can, whatever I have experienced, I can help them out.
Yes, all of you should. Whoever passed, don't forget this IMG family. Just try to help all of the candidates who needs, right? So that's the main goal. Okay, so
Yes,
anyone
sir.
wants to ask anything to Dr. Aishwarya? Anyone?
Hello.
Yes,
Hello,
Dr. Monica.
Doctor.
Hello.
Hello. Hello, Doctor. Congratulations.
Thank you so much.
Thank you. I'd like to ask the same question again. So, did you get any kind of like new question? or new
Yeah,
thing which is not in the note?
Yes, ma'am, there were a few new questions, and some of them, and I think the examiners in Kolkata were very nice. I really didn't expect it, because as the mocks, we were like, what we hear is that the examiner doesn't go back to a question, or they are very strict. They will just take one answer, and if you want to change it, they won't let you. But the examiners here were very nice, and they asked us, are you sure? And one of them, I think, even gave clues. So that was very I mean, it was confusing. I didn't know if they were trying to, misguide me or mislead. I really didn't know. But then there were new questions, and some of them, most of them actually helped. They were like, are you sure? So if this is the case, what else? They were reframing the questions, and they made sure you come to that answer.
All right.
Yeah, so
Okay.
they were, I think, mostly in the knowledge stations and pathology, especially. Critical care, I feel it's all the same. Anatomy also, it's almost the same. It's the same questions, but in different words. The pictures were beautiful. You can easily identify it. Of course, it's not the same pictures which are in the notes. And the dissected pictures are very vividly colored, like the muscles are red ish in color. Okay, so, and it's very nicely dissected, so you can actually make out. That won't be a problem at all. I was very worried about the anatomy pictures, and but no, you don't have to be worried. And apart from that, I think anatomy and critical care, if you focus on these two, because most of these questions, at least 90%, I would say, are from notes. Okay, maybe one question or two questions could be different, but I think anatomy and critical care, you can easily make sure you do well. So the other two pathology stations, even if it doesn't go well, it's fine. You will clear knowledge.
All right. Okay. Thank you, doctor.
Yeah.
Thank you.
Thank you.
Dr. Aishwarya, congratulations to you.
Thank you so much.
I was asking about the faculty. Was faculty from the India only, or
Yeah.
they came from the
So
UK?
there was a mixture. There were mostly Indians, and there were also few British examiners. The British examiners, so according to my experience, and I feel that the British examiners were a little more strict. Like, there was this one examiner who wouldn't even smile. He would just ask a question, and as soon as I say something, he moves to the next question. Okay, there were those kind of people also, but there were some other little more friendly, nicer, examiners who would say, okay, are you sure about this? Do you want to come back to this later? We'll come back to this later. As soon as I answer a wrong answer, he would be like, okay, we'll come back to this later. Like, okay, so we'll come back to it later. So there were examiners like that also. And that was actually very, very surprising to me, because I didn't expect it. But I think it's all luck. I really don't know.
You passed. Congratulations again.
Thank you so much.
All right. Anyone else wants to ask anything? Dr. Sanika.
Dr. Aishwarya.
Hi, thank you so much, Sanika.
So, about the clinical examination stations, were you directly able to communicate with the patient, or was there someone in between to translate for you?
So I think one patient was an actual, patient. He was Bengali, I think, and he was a CVS patient who had a thoracotomy scar and everything, right? So he had a translator, but then I think I was on the third day, since he was kept on all 3 days. The same guy, same examination was there on all 3 days. So I think by then he knew exactly what to do. The translator didn't even, like, he just, I would say, okay, show this. He would just, sit in that position. He would do the auscultation maneuvers. He knew everything. So I didn't face any translator related problems, but yes, there were two stations, right? So one of them was an actor. The other one was an actual patient who needed a translator. The other actor was very nice. He was an English speaking man.
Total 3, right? So 2 were actors and 1 was a real patient.
Yeah, no, I think the other one also was real. The other one also had a translator, but I didn't face any issue, I think.
So the translator was very much professional. He was quickly telling him to do
See, it wasn't needed. It wasn't necessary because the patient would do it before that. Some of them were actually, the assistants were not that great. I even gave feedback to RCS regarding it, because in my catheterization station, I asked the assistants to, help me. I'm asking him where the, I think the kidney or something was missing. He was kept somewhere else, and he just kept looking at me. I'm like, can you please tell me where it is? Show me where it is. Can you please? And the cart wasn't moving. And I was trying to pull it in middle, and then it's not moving. And he's just standing there and doing nothing. And the examiner's just walking around the place. It was very haphazard. So there could be some things like that. The assistants will not help you, will do nothing. They'll just stand in one corner.
Okay, so we act for ourselves, right? We know the steps, so we just act according to
Yeah, we
whatever
have to
we
go bring
have.
everything on our own sometimes. Like the gloves also, I have to ask him where it is. He didn't show me. I had to look for it. It was like a treasure hunt for me in the station. I have to look for each thing and bring it myself. He didn't even say anything. And I was the first one to go there. I think maybe that's why I was not experienced. It was not
maybe.
that great. But see, even after that, make sure you're calm. It's okay. I forgot about it. There are so many things I actually forgot. I left it in the station and I came out. Even now, I don't remember.
That's good.
It's like that.
Yeah, that's good.
So one more thing I want to add is when you're practicing, in the beginning, I used to practice one station at a time, right? But sometimes try to with your partner. Of course, I hope everybody has a study partner. It's very important. So with your study partner, make sure that you practice a series of cases, like a complete mock, like stations, for example, like 5 or 6 stations together, or 10 stations together. That will give you a practice
Like a simulation
of how
mock.
to, yes, sir, how to forget.
Yeah.
How to forget the previous station and move to the next station. Because the first time I did the simulation mock, I was very, not, I was very stressed. I couldn't answer. One station is gone. The other stations are also a disaster. So just make sure you practice that also. I think that will help a lot. We did that for a few days. And I went to Kolkata a few days earlier and I practiced again skills and everything with my partner, study partner. So I think that also will help.
Thank you so much. And also about like the knowledge station, some questions are, you have to just remember the points because they wanted exactly how it is. So
Yes.
were they coming back to you on the exam day?
No,
Because
no.
I get really scared about those questions that are, directly handpicked that you have to answer it this way.
Yeah, that is exactly what they want. Just give it to them. Okay, they'll be very happy. They just move to the next question. That is what they're expecting. That is what their paper also suggests.
Yeah. Thank you. Thank you so much.
Thank you so much.
In the clinical examination, were the patients real or they were actors?
Yeah, so there were 2 real patients and one was actor. There was a spine examination. The spinal examination guy was an actor. And there was CVS and peripheral vascular examination, that one, artery examination. So that one also was a real patient. But I couldn't find a lot of findings. And Doppler, that station I went and asked her that I'll do a Doppler because I finished it well before 6 minutes. And the examiner said, no, don't do it. And then I said, okay, so then ma'am, this completes my examination. She's like, do you want to do something else? And that confused me a lot. But I think she only asked that the examiners have to ask if you if you finish it before 6 minutes, they have to ask you, do you want to do something else? But I got again very anxious. I'm like, oh, I must have forgotten something. But don't get anxious. Okay, if you're finished, if you're confident that you've finished your examination, it's fine. So that's one more thing I'd like to add.
What was the CVS case you got?
CVS case, sir, I've forgotten now. There was a thoracotomy scar and there was a murmur also. And I had also spoken.
Case. I guess.
Yeah,
Valve
yes,
replacement.
yes, sir.
So
And I'd
most of the
also
time, they are valve replacement cases only, I think.
I'd spoken to the previous doctors who had given the exams on the first and the second day, and we kind of knew that this case might come, so I'd prepared like that.
Great. Thank you so much.
Thank you so much, sir.
Yeah, excuse me, ma'am.
Hello.
Yeah, excuse me.
Yes, please.
Yeah, congratulations for your success, ma'am.
Thank you so much, sir.
I just want to know, how did you practice or prepare for your skill part? Because
Yeah, so I actually attended one hands-on course that was available locally, and apart from that, I used to practice notes wherever I could, using a thread or So and
not only the procedure part, even his communication history and all
communication
the
history. Again, so
examination and
this is
everything.
with my partner, with my study partner only, and sir's mocks I used to listen. If I have any doubts on the way I am performing, I would go back to sir's mocks and see, okay, is this how it should be done, or am I missing something? So I used to go back and see it and try to recreate it or try to do something similar. And his marks, like his feedback to the participant, I used to listen, and then I take that feedback for myself and be like, okay, so this is how I should do it. Yeah, mostly I would just listen to people do it and then try to recreate it mostly, and practice with my study partner as much as I could.
Okay, thank you.
Thank you, sir.
All right. So thank you, Dr. Aishwarya, for being with us. It's been a pleasure. Okay. And I'm so happy that you made it. Okay.
Thank you so much.
Superb job. I'm proud.
Thank you,
Very
sir.
nice. Very nice. Excellent.